So these are the features of the dural venous sinuses. They lie between the layers of the dura mater and they have no muscles in their walls. See, these are the venous sinuses. You can see these are the extensions of dura mater. This is pharynx cerebri. This one is tentorium cerebelli. Here will be the pharynx cerebelli like this. Along the margins of this extension of dura mater, you will see the dural venous sinuses. So they have no muscles in their walls and they are lined by endothelium. Valves are absent in these sinuses and receives venous blood and CSF. So these are the important features of dural venous sinuses. Venous sinuses are important for your long question. Okay, paired and unpaired sinuses you have to know, and also important for your viva table, bones viva. Okay, and cavernous sinus, important long question for theory. Cavernous sinus, also other sinuses can be counted as paired sinus or unpaired sinus. It can come in your theory. Okay. So these features can also come as a part of long question. So these are the features. Next. So we will classify the sinuses as unpaired sinuses and paired sinuses. Unpaired sinuses are superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous, posterior intercavernous, and basilar venous plexus. So these are unpaired sinuses. And paired sinuses are cavernous sinus, superior petrosal, inferior petrosal, transverse sinus, sigmoid sinus. Transverse sinus continues as the sigmoid sinus and which further continues downward as the internal jugular vein. Next there is phenoparietal and petrosquamous sinuses. Next, see here. See, this is along the upper margin of the pharynx cerebri. This sinus is the superior sagittal sinus. Along the lower margin of the pharynx cerebri, here is the inferior sagittal sinus. Inferior sagittal sinus joins with the great cerebral vein of Galen and forms this straight sinus. This is straight sinus. And at this place, two transverse sinuses, straight sinus and the superior sagittal sinus is meeting. So this point is known as confluence of sinuses. Very frequently asked in your viva, what is a confluence of sinuses? Okay. Here, this point at the internal occipital protuberance lies this confluence of sinuses. And from here you can see this is transverse sinus, one on left side, one on right side, and this transverse sinus are continuing downward. This S-shaped curved portion, this is known as sigmoid sinus, and this sigmoid sinus continuing downward as the internal jugular vein. Okay, so these are the sinus visible here. Here on the two sides of the body of the sphenoid, here you can see these are the cavernous sinuses. Okay, and these cavernous sinuses are connected to this transverse sinus via the superior petrosal sinus and with the internal jugular vein via this inferior petrosal sinus. It lies along the upper margin and lower margin of the petrous part of the temporal bone. So all the sinus you can see from this picture. Next, see here folds of dura mater is clearly visible. This is pharynx cerebri along the upper margin superior sagittal sinus and it is starting from here foramen cecum. Foramen cecum is junction near the cribriform plate of the ethmoid at the junction between the frontal crest and the crista galli. Okay. Here in this region lies the foramen cecum. From here this is frontal crest and here will be the crista galli. So here is the foramen cecum. From here superior sagittal sinus is starting. It is extending upward and going to this internal occipital protuberance here. Okay, here up to the confluence of sinuses. So this is superior sagittal sinus, here is inferior sagittal sinus, this is straight sinus, here is the confluence of sinuses, and this fold which is lying horizontally, this fold is lying vertically, falx cerebri, this fold of dura mater, this is lying horizontally, this is tentorium cerebelli, okay, separating the cerebrum from the cerebellum. And here in the internal occipital crest, here in the internal occipital crest, here is attached the tentorium cerebelli. Falx cerebelli. Falx cerebelli is separating two lobes, right and left lobes of the cerebellum. Okay, along its attached margin lies the occipital sinus. Here, in this region lies the occipital sinus. And this is petrous part of the temporal bone. Here will be the superior and inferior petrosal sinuses on the two sides of the body of sphenoid. These are the cavernous sinuses, and you can see the cavernous sinuses are connected via small sinuses. These are intercavernous sinuses. There are anterior and posterior intercavernous sinuses. These are unpaired. And here is the petrosal sinus. Superior will be along the upper margin, inferior will be along the lower margin of the, these are inferior petrosal sinus. Next, here also you can see superior sagittal sinus, inferior sagittal sinus, straight sinus, transverse sinus, sigmoid sinus, continuing as internal jugular vein, and here you can see the cavernous sinus. Connecting sinuses are the intercavernous sinus, and it is connected to other veins. Okay, that's why cavernous sinus is important, because thrombosis is very common here, and important nerves and arteries are passing through the cavernous sinus. Next, see here, this is confluence of sinus at the internal occipital protuberance. Here is the internal occipital crest, here lies the occipital sinus. These are the two transverse sinus. Right one is continuation of superior sagittal sinus, and left one is continuation of the straight sinus. Okay, straight sinus lies at the junction between the falx cerebri and tentorium cerebelli, and they are continuing as the sigmoid sinus, coming out through the jugular foramen and continues downward at the internal jugular vein. On the two sides of body of the sphenoid, here is the hypophyseal fossa, pituitary gland is lying. These are the two cavernous sinuses, okay? And within the cavernous sinus lies the internal carotid artery. You must have seen carotid sulcus on the two sides of body of the sphenoid, and the two cavernous sinuses are connected via intercavernous sinuses, anterior and posterior intercavernous sinuses. This is phenoparital sinus. Phenoparital sinus is lying along the posterior margin of lesser wing. This is lesser wing of sphenoid, so along the posterior margin, this is phenoparital sinus. And here you can see superior petrosal sinus connecting the cavernous sinus with the transverse sinus, and inferior petrosal sinus connecting the cavernous sinus with the internal jugular vein. Okay. So this sinus you can see here. Next. So we will discuss individual sinuses in details. Okay. First we will go to the superior sagittal sinus. Superior sagittal sinus occupies the upper fixed border of the falx cerebri, and it begins in the front at the foramen cecum, where it receives a vein from the nasal cavity, and it runs backward, grooving the vault of the skull, and at the internal occipital protuberance it deviates to one side, usually to the right side, but sometimes can also there is connection between with the left transverse sinus, and becomes continuous with the transverse sinus. Okay, we have seen in the pictures. Next, this superior sagittal sinus, it communicates through small openings with 2 to 3 venous lacuna on the each side. And numerous arachnoid villi. Arachnoid villis are lying along this midline. Okay, arachnoid granulations. This helps in absorption of the CSF. Okay, so numerous arachnoid villi and granulations project into this lacuna, which also receive the diploic veins, emissary veins, and meningeal veins. Diploic tissue is this in between the outer plate and inner plate of the skull bone. This tissue is spongy tissue lying here is the diploid tissue, and the veins lying here is the diploic vein. So they also drain into this superior sagittal sinus. Emissary veins are passing through foramen lacerum, foramen spinosum like this. Also meningeal veins. Meningeal veins are supplying the meninges, 3 layers of the meninges, dura mater, arachnoid mater, pia mater like this. Okay, so all these are draining into the superior sagittal sinus, and it receives the superior cerebral veins. Okay, you have read superior cerebral veins during blood supply of brain. They are supplying the superolateral surface of the brain. Okay, draining into superior sagittal sinus. At the internal occipital protuberance, it is dilated to form the confluence of sinuses, and which is connected to the opposite transverse sinus and receives the occipital sinus. Next. See here, this is a section, enlarged view of the superior sagittal sinus transverse section. This is skull bones, okay. In the midline, this is dural fold, falx cerebri. Within the 2 layers of dura, there are 2 layers in the cranial cavity. Endosteal layer, meningeal layer. Endosteal layer is lining the bone, meningeal layer is lining the meninges, other meninges, arachnoid mater, pia mater. So these are the arachnoid granulations projecting into the cavernous side, projecting into the superior sagittal sinus. Okay. Here is the location of superior sagittal sinus. Next. अच्छा, previous one आगे जाओ एकटू. See, these are the emissary veins. Emissary veins are draining from the scalp, connecting this cavernous sinuses with the scalp. And here are the diploic veins. Diploic veins are lying in between the 2 plates of the flat bones. So all these veins, and this is meningeal veins supplying the meninges. You can see all these veins are going to drain into this superior sagittal sinus. Okay. Next. So thrombosis of superior sagittal sinus. There is spread of infection from the nose, scalp, diploid to the superior sagittal sinus. Scalp via the emissary veins, diploid via the diploic veins, nose, some veins of nose are also draining here. May cause its thrombosis. And what will be the presenting feature of this thrombosis? There will be marked increase in intracranial pressure due to defective absorption of CSF. Arachnoid granulations are projecting here. So if there is defective drainage of CSF, intracranial pressure will increase. Okay? And there will be delirium due to congestion of the superior cerebral veins. Delirium is a disoriented state. Okay? So due to congestion of superior cerebral veins, because blood supply of the brain is impaired, so there will be delirium. Okay. Next is inferior sagittal sinus. It occupies the free lower margin of the falx cerebri. It runs backward, joins the great cerebral vein, which is formed by the union of 2 internal cerebral veins. These are very frequently asked. How the straight sinus, what is the fate of this great cerebral vein, or how the inferior sagittal sinus drains like this. Okay. So it runs backward, joins the great cerebral vein, which is formed by the union of 2 internal cerebral veins at the free margin of tentorium cerebelli to form the straight sinus. Okay. And it receives cerebral veins from the medial surface of the cerebral hemisphere. Next. See here, this is inferior sagittal sinus lying along the inferior margin of the phalanx cerebri. They are joining with the great cerebral veins. Great cerebral vein is formed by joining of two internal cerebral veins, and this inferior sagittal sinus and great cerebral vein joins to form this straight sinus. Okay, straight sinus is meeting at the point of confluence of sinus, mainly joined with this superior sagittal sinus. Okay, next. Next we go to the straight sinus. It occupies the line of junction of falx cerebri with the tentorium cerebelli. We have seen in previous picture, and formed by the union of inferior sagittal sinus with the great cerebral vein. It ends by turning to the left side, sometimes to the right, to form the transverse sinus. Okay. Mainly it is forming the left transverse sinus, connected to the left transverse sinus. Next. And superior sagittal sinus is continuing or connected with the right transverse sinus. Okay. Okay, so see here, this straight sinus, it is continuous with the transverse sinus. Next we go to the transverse sinus. Their paired sinus begin at the internal occipital protuberance. Right sinus usually continuous with the superior sagittal sinus. Left is continuous with the straight sinus. And each sinus occupies the attached margin of the tentorium cerebelli, grooving the occipital bone and posterior inferior angle of the parietal bone. And they receive the superior petrosal sinuses, inferior cerebral and cerebellar veins, and diploic veins. Okay, and they end by turning downward as the sigmoid sinuses. Next, see here is the right transverse is continuation of superior sagittal, left transverse continuation of straight, continues as the sigmoid sinuses. And sigmoid sinuses are coming out as internal jugular vein through the jugular foramen. And they are connected, this transverse sinus is connected via the, with the cavernous sinus via the superior petrosal sinus. Okay. Next we go to sigmoid sinus. They are direct continuation of the transverse sinuses. And each sinus turns downward and medially and grooves the mastoid part of the temporal bone. Here it lies behind the mastoid antrum, and it then turns downward through the posterior part of jugular foramen to become continuous with the superior bulb of internal jugular vein. Okay. Next, see here, this is straight sinus, superior sagittal sinus, confluence of sinuses, occipital sinus along the internal occipital crest. This is sigmoid sinus. Transverse sinus continues as sigmoid sinus, and here is the internal jugular vein. And you can see superior petrosal sinus is connected to transverse sinus, inferior petrosal sinus is connected to internal jugular vein. And this is great cerebral vein of Galen, formed by joining of internal cerebral veins, and they are joining with the inferior sagittal sinus to form this straight sinus. Okay. Next. So the sigmoid sinus is separated from the mastoid antrum and mastoid air cells by thin plate of bone. And the thrombosis of sigmoid sinus is therefore secondary to infection of middle ear or mastoid process. Middle ear is connected to the air cells of the mastoid antrum. Okay, so in middle ear infection can spread to the sigmoid sinus. This is important clinical aspect. Okay, and further, utmost care should be taken not to expose the sigmoid sinus during operations on the mastoid process. Okay. Next is superior and inferior petrosal sinuses. Petrosal sinuses, they are small and situated on the superior and inferior border of petrous part of temporal bone on each side. See, this is the petrous part of temporal bone, this projecting part. So along the superior margin will be the superior petrosal sinus and inferior margin will be the inferior petrosal sinus. You have also seen in the pictures. So each superior petrosal sinus drains the cavernous sinus into the transverse sinus, and each inferior sinus drains the cavernous sinus into the internal jugular vein. Next, see here, straight sinus, transverse sinus, and here you can see the superior petrosal sinus, okay, along the superior margin of the petrosal polar, connecting cavernous sinus with the transverse sinus. Okay. Next we go to the occipital sinus. Here is the location of occipital sinus. From the confluence of sinuses, it extending downward along the internal occipital crest. So occipital sinus, it is a small sinus occupying the attached margin of falx cerebri. Here is the attachment. This is posterior cranial fossa, location of the cerebellum, and this is internal occipital crest. It gives attachment to falx cerebellum, separating the two lobes of the cerebellum. Okay. So this occipital sinus occupying the attached margin of falx cerebellum, also extension of dura mater, and it communicates with the vertebral veins near the foramen magnum. Superiorly, it drains into the confluence of sinuses. Here, it is draining into confluence of sinuses. Next applied aspect, confluence of sinuses, also known as torcular hierophilia. Okay, this name is also asked in your viva and comes in your MCQs. Okay, torcular hierophilia, confluence of sinuses, and it can also come as a short note, confluence of sinuses. It is the region where the superior sagittal and straight sinuses end and the right and left transverse sinuses begin, and the occipital sinus also drains into the confluence of sinus, and the confluence of sinuses is situated near the internal occipital protuberance. Next we will go to basilar venous plexus. Okay, basilar venous sinus, it consists of network of veins lying between the two layers of dura mater on the clivus. It connects the two inferior petrosal sinuses and communicates with the internal vertebral venous plexus. Okay, and it receives the blood from the pons and medulla, and thrombosis of the basilar venous plexus is therefore usually fatal. Next we go to the sphenoparietal sinus. Sphenoparietal sinus lies along the posterior free margin of lesser wing of the sphenoid. Here you can see these are the lesser wings. Along the posterior margin of lesser wings lies the sphenoparietal sinuses. Okay, and it is connected to the cavernous sinus. Lesser margin of sphenoid and drains into the anterior part of the cavernous sinus. Next is petrosquamous sinus. This sinus lies in the petrosquamous suture and if present and drains into the transverse sinus. It is not always present. Okay, in some patient it may be absent. That is normal. Next is anterior and posterior intercavernous sinuses. The anterior and posterior intercavernous sinuses, they connect the two cavernous sinuses on each side, and they pass through the diaphragmus celli in front and behind the opening for infundibulum of the pituitary gland respectively. Okay. Intercavernous sinuses and cavernous sinuses together form the circular sinus. Okay. So anterior intercavernous sinus passes in front of the infundibular stalk. Posterior one passes posterior to the infundibular stalk, and on the two sides two cavernous sinuses are present. So together they will form a circle. That is known as circular sinus. Okay, sometimes asked in your viva and can come in your MCQ. What is circular sinus or like this? Okay. Next Next we go to cavernous sinus. Very important long question, very frequently given in your theory. Okay, cavernous sinus. Location. They are situated in the middle cranial fossa on each side of the body of the sphenoid bone. Here, on the this is body of sphenoid. On the two sides of body of sphenoid lies the cavernous sinus. What is the extent? Each sinus extends from the superior orbital fissure. Here lies the superior orbital fissure. You can see just below the lesser wing of sphenoid. Okay, so it extends from superior orbital fissure up to the apex of the petrous temporal. Superior orbital fissure in front to apex of the petrous part of temporal bone behind. Okay, next. See here, this is superior orbital, this is lesser wing. Here was sphenoparietal sinus. So these are the cavernous sinus. Extend anteriorly up from the superior orbital fissure, posteriorly up to the apex of the petrous temporal. This part is petrous part of the temporal bone. This is superior petrosal sinus, inferior petrosal sinus. And you can see this is anterior intercavernous, posterior intercavernous, and here is location of pituitary gland. So this is together forming the circular sinus. Okay, understood? Next. So relations of the cavernous sinus. Superiorly, you have seen the parts of the brain, inferior surface of the brain. These structures were located there. So superior relation of this cavernous sinus will be optic chiasma, optic tract, internal carotid artery, anterior perforated substances. And inferiorly lies the foramen lacerum. Foramen lacerum lies at the posterior end, junction of the body and greater wing of the sphenoid bone, mainly the body parts. Medially, there will be pituitary gland. You have seen infundibular stalk, it is connected to pituitary gland, and sphenoid air sinus, which is lying within the body of the sphenoid. Next. Lateral relation will be temporal bone and cavum trigeminal. Cavum trigeminal is a depression containing trigeminal ganglia, which is a part of petrous temporal. And anteriorly lies the superior orbital fissure. Here, anteriorly superior orbital fissure. Okay, laterally temporal bone, medially body of sphenoid containing pituitary gland and sphenoid air sinus. Posteriorly, here will be the lacerum, foramen lacerum near the apex of the petrous temporal. And posteriorly, here will be the crus cerebri, apex of the petrous temporal bone. Next. So, structures present in the lateral wall. This is very frequently asked in your viva. Okay, for bone stable, also important cavernous sinus. See, this is a section, coronal section through the cavernous sinus and sphenoid bone. See, this is pituitary stalk, pituitary gland. This is the cavernous sinus. These are the body of sphenoid containing the sphenoid air sinus, and from below the sphenoid, from the body, these are the forming nasal cavities. Okay, this is rostrum forming nasal septum, and these are forming lateral wall, lateral nasal wall. And you can see this on the lateral side of the cavernous sinus, four structures, four nerves are related. Third, fourth, two divisions of fifth nerve. Third is oculomotor, fourth is trochlear, and ophthalmic and maxillary division of the fifth trigeminal nerve. And here is the located within the cavernous sinus. This artery is the internal carotid artery. Okay, and it is surrounded by some nerve plexuses. Sympathetic nerve plexus is lying around this internal carotid. And this nerve, this is sixth cranial nerve, abducent nerve. Okay, mainly those nerves going towards the orbit are lying around this cavernous sinus. This third, fourth, ophthalmic, these abducents all are entering into the orbit through the superior orbital fissure. Okay, and internal carotid artery, it extends, it passes through the sinus, then it turns upward and supplies the meninges and brain. Okay. So this diagram you practice a schematic diagram like this. So structures present in the lateral wall are these four nerves from above downward: oculomotor, trochlear, ophthalmic, maxillary. Okay, understood? Next, this diagram is same thing: oculomotor, trochlear, ophthalmic, maxillary. Here is internal carotid artery passing through the sinus, and this is abducent, sixth cranial nerve. This is pituitary stalk, pituitary, and here is the sphenoid, air cells within the body of the sphenoid. Okay. Next, so structure passing through the cavernous sinus are these. Okay. Internal carotid artery surrounded by sympathetic nerve plexus and abducent nerve. Internal carotid, abducent. Next we go to tributaries of cavernous sinus. Okay, this comes in your theory. Tributaries are from the orbit, from the meninges, from the brain. From the orbit, superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. Here it has been shown: superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. Next, from the meninges, sphenoparietal sinus and middle meningeal vein, anterior trunk of middle meningeal vein. And from the brain will be superficial middle cerebral vein and inferior cerebral vein. So all these are tributaries of the cavernous sinus. Next. So from the vein, superficial middle cerebral vein here, and this is inferior cerebral vein. Okay. And these are the emissary veins. Emissary veins are passing through foramen oval and spinosum and connecting to different venous plexus, basilar venous plexus, pterygoid venous plexus, like this. And here this is the superior petrosal sinus, inferior petrosal sinus. Via this connected to transverse sinus, internal jugular vein. And some veins are also connecting this to a near forming plexus near the clivus. Next. So what are the communications of cavernous sinus? Transverse sinus connected to transverse sinus via the superior petrosal sinus, and it is connected to internal jugular vein via the inferior petrosal sinus. And pterygoid venous plexus via emissary veins communicate through foramen oval and lacerum. And it is connected to facial vein via deep facial vein. Okay, and this connection is important because there is dangerous area of face. It is called dangerous area because it is connected to cavernous sinus, and infection in those areas will lead to infection of cavernous sinus and cavernous sinus thrombosis. If thrombosis occurs, it will create pressure over all the nerves surrounding the cavernous sinus and important artery, internal carotid artery. So there will be problem. Next. So here you can see some tributaries and communications. Central vein of retina, superior ophthalmic vein. Okay, all these are draining into this cavernous sinus. And these are the connections: superior petrosal sinus, inferior petrosal sinus. This is middle meningeal vein. Okay, superficial middle cerebral vein, inferior cerebral vein. And these are the anterior, posterior, intercavernous sinus connecting the two cavernous sinuses. Okay, so previous diagram we practice very carefully. Next. So opposite cavernous sinus, it is connected to opposite cavernous sinus via anterior and posterior intercavernous sinus, superior sagittal sinus via superficial middle cerebral vein and superior anastomotic vein. Internal vertebral venous plexus via the basilar venous plexus. Okay. See here is schematic diagram. These are intercavernous sinus connecting the two cavernous sinus. This is superior ophthalmic vein, sphenoparietal sinus, emissary vein connected to pterygoid plexus, and here is superior petrosal connecting to transverse sinus, inferior petrosal connected to internal jugular vein, and these are the emissary veins connected to basilar venous plexus. Okay. Next is applied aspect of cavernous sinus. Cavernous sinus thrombosis. Septic thrombi of cavernous sinus may be caused by its numerous connections. That's why the connections are important. Symptoms are severe pain in the eye and forehead, ophthalmoplegia, paralysis of the ocular muscles. Paralysis of ocular muscles due to involvement of third, fourth, and sixth nerve. It was supplying the extraocular muscles. And exophthalmos, abnormal protrusion of the eyeball or eyeballs. Okay. Next, sometimes on one side is involved, sometimes both sides are involved. Okay. So, arteriovenous communication. If the internal carotid artery, which was passing through the cavernous sinus, if it ruptures in fracture of base of skull, an arteriovenous communication of fistula is established between the artery and the cavernous sinus. And consequently, the arterial blood rushes into the cavernous sinus, enlarging it, forcing blood into the connecting veins. Arterial pressure is more than the venous pressure, so arterial blood enter into the cavernous sinus, which is a part of vein. Okay. Next, and then it will increase the pressure in the cavernous sinus. Arteriovenous communication gives rise to the following signs and symptoms. There will be pulsating exophthalmos. Artery, there will be pulsations. So this pulsation, if it is connected to the cavernous sinus, this pulsation will be transmitted to the veins also, and that you will see. So pulsating exophthalmos, the eyeball protrudes and pulsates with each heartbeat. Okay, a loud bruit, loud systolic murmur is easily heard over the eye. And ophthalmoplegia due to involvement of ophthalmoplegia means paralysis of the eyeball. It cannot move due to paralysis of extraocular muscles due to involvement of third, fourth, and sixth cranial nerves. And there will be marked orbital and conjunctival edema due to raised venous pressures in the cavernous sinus. Okay. Next, see here, this is a patient of cavernous sinus thrombosis. See this eyeball is coming out. Okay, there is edema and redness due to increased venous pressure, conjunctival edema. Okay, and there will be pulsating exophthalmos. You can feel the pulsations. Okay, next, here also you can see it is involving one side. Previous one, both the sides were involved. Here one side is involved. Okay, conjunctival edema and edema over the eyeballs, veins. Okay, next. Okay, that's all.